Bowel, or piles, is an intensely painful condition caused by chronic constipation. Every trip to the bathroom can feel like a crisis, but managing that pain does not need to be a confusing or chaotic experience. It is a mechanical problem with a step-by-step solution. We are going to build a complete 4-step at-home relief routine. Together, we will walk through exactly how to identify your specific symptoms, request the right lab tests, schedule your medications, and apply immediate physical relief. Before we begin step 1, you will need to gather your prescribed medications, a shallow basin or tub, and a bottle of betadine. As always, consult your doctor before starting any new medical regimen to ensure it fits your specific health profile. Having a structured, predictable daily plan takes the guesswork out of your recovery. We are going to transform a painful medical issue into an actionable, manageable process. Step 1 is evaluating your physical symptoms. Pay close attention during a bowel movement to see if you can feel a soft mass or swelling near the anus, also known as the Gouda marg. This flowchart interprets the swelling. Tracing the left path reveals the primary symptom of piles, fresh red blood without pain. On the right branch, sharp pain alongside bleeding shifts the diagnosis to a fissure, a skin tear, not swollen veins. Precise symptom identification is your crucial first step. Misidentifying a fissure as piles leads to applying the wrong treatments, which delays your recovery and prolongs your discomfort. Step 2 takes us into the doctor's office. Professional medical diagnostics are necessary to determine the exact grade and physical severity of your swelling so you get the correct prescription. Your doctor will perform a mechanical exam. This is usually a digital rectal exam or a proctoscopy. A proctoscopy is a straightforward procedure where the doctor uses a small, lighted tube to visually inspect the interior anal cavity. If you have been experiencing heavy, repeated bleeding, you need to explicitly ask your doctor to order a CBC, or complete blood count test. Asking for a CBC prevents a massive diagnostic blind spot. The test measures your hemoglobin, the protein in your red blood cells that carries oxygen. Checking this ensures your internal blood levels haven't dropped to dangerous levels due to the prolonged bleeding. Step 3 is organizing your at-home prescription protocol. Grab a 7-day pill organizer so we can map out the exact schedule for your Tab Daflon 500 mg tablets. On this 7-day calendar, observe the heavy initial dosage. Days 1 through 4 require 2 pills simultaneously, 3 times a day. For days 5, 6, and 7, the protocol enters a step-down phase, dropping to 2 pills taken twice daily. Now we shift focus to your nightly anti-constipation routine, using an oral laxative syrup like Cremafin or Lactulose. Measure out exactly 15 to 20 milliliters of the syrup. You must take this specific dose right before you go to bed. This schedule operates on a dual-action logic. The Daflon actively works through your bloodstream to shrink the swollen veins, while the nighttime laxative ensures your stomach remains completely clear by morning, preventing the hard stool that re-injures the area. Step 4 is immediate local relief. Start by applying a prescribed topical ointment like Anivate or Shield Cream directly to the swollen area to quickly numb the baseline pain. Next is the most critical physical task of your entire daily routine: preparing the Sitz Bath. This illustration demonstrates the correct physical setup. You need a medical plastic basin secured over your toilet seat, filled with mildly warm water, gungguna pani. Never use hot water, as it can cause burns and worsen the inflammation. Once the basin is filled, mix exactly 1 capful of liquid betadine directly into the lukewarm water. Sit bare-skinned in the prepared bath. You need to remain submerged for exactly 10 minutes to allow the treatment to work. The physiological mechanism here is highly effective. The lukewarm water physically relaxes the tight sphincter muscle and helps the swollen veins shrink back to normal size, while the betadine actively sanitizes any microscopic open wounds. Combining the targeted numbing of topical creams with the daily hydrotherapy of this Sitz Bath yields the fastest, most measurable physical pain relief in the entire medical protocol. You now have a completed functional routine. Your symptoms are verified against a fissure, your 7-day Daflon pill schedule is strictly mapped out, and your daily Sitz Bath protocol is ready to execute. Medical treatments provide necessary, immediate relief from the pain. However, dietary adjustments are the only permanent cure to stop this cycle from repeating. To prevent the return of severe constipation, you must heavily increase your daily water intake and ensure that green, leafy vegetables are physically present on your plate at every main meal. True recovery happens when you manage today's pain with a structured medical routine, while fixing the underlying dietary habits for tomorrow. Stick to the schedule, stay hydrated, and we wish you a fast and full recovery.